We are back on No Copay Radio. Thank you for hanging in there. Happy Sunday. It's in the 7:30 half hour on Cozy 101.1, and we're brought to you by Dr. Cog, the Denver Regional Council of Government's Area Agency on Aging, which is run by my partner on No Copay Radio, Jayla Sanchez-Warren. And Jayla, we got another special guest here.
I know. I'm so excited. Meg Donahue. She's the director of the Family Services and Community Engagement for the Colorado chapter of the Alzheimer's Association. She's a graduate from Central Michigan University. Yay! Meg has obtained her bachelor's degree of arts in gerontology and family studies. After moving to Colorado, she became a licensed nursing home administrator, as well as pursuing her master's degree in healthcare administration. And now she's with the Alzheimer's Association and here to talk to us about Alzheimer's disease.
Hey, Meg, good morning.
Good morning. Thank you both for having me on today. I'm excited to be here.
Well, I don't know. With all that education you have, I don't know if you had time to work. Holy cow, you've been in school. Jeez. That's fantastic. Congratulations on that, though. That's a lot of good stuff.
Well, thank you. I do love continuing education, so
yeah.
it's more fun than anything.
I haven't got past 2 plus 2, so don't ask me any tough questions.
You're off to a great start.
Yeah, well, somebody had to start me somewhere. So anyhow, Meg, let's get down to it. Let's talk about how big of a healthcare challenge Alzheimer's disease is. We hear about it, but we're finding out more about it. It's pretty big, though, right?
It's pretty big, yeah. So Alzheimer's impacts more than just the individual with the disease. It's important to note that more than 16 million family and friends provide over 18 billion hours of unpaid care annually. So this results in an additional $10+ billion increase in healthcare costs due to the burden of caregiving. So hearing that and knowing that nearly 6 million Americans are living with Alzheimer's today, that annual cost of caring for them exceeds $250 billion.
Yikes.
So it is the most expensive disease in the nation, which is significant because the weight of those caregiving responsibilities is only projected to grow. And by 2050, as many as 14 million could be living with Alzheimer's. And that cost will exceed $1 trillion.
I can't get past those numbers. That's unbelievable.
Yeah, I think that a strong, if we were to talk in terms of intervention, a strong public health response is an extremely important step, as it can help to mitigate the future impact of Alzheimer's. Alzheimer's and dementia doesn't discriminate. So with that, our goal is to raise awareness, overcome the myths and misconceptions and stigmas that surround Alzheimer's and other dementias, and also work towards breaking down cultural barriers so that we can educate more people and educate them on early detection and also reminding them that they're not alone on this journey.
Wow, that's incredible, Jayla. No wonder Dr. Cog got involved. Those are huge numbers.
Huge numbers.
Yeah, they're huge numbers.
And in Colorado alone, there's over 76,000 Coloradans currently living with Alzheimer's, and it is the 6th leading cause of death. So in Colorado alone, it's our focus to focus there, but on a national world ground, it's significant. So, yep.
Well, you talk about caregivers, and Jayla, you and I talk about caregiving all the time here. A lot of these caregivers are family members that don't have a real education about Alzheimer's and how to handle somebody in their life that's obviously needs that kind of help. Don't you offer like a free service over there at the Alzheimer's Association for that?
Yeah, we do. So it's our 24/7 hour helpline, and it's a wonderful free service that's available around the clock, 365 days a year. Anyone can call in and speak with a master's level clinician who can offer confidential support and information to people living with dementia, caregivers, families, and the public. And it's they offer over 200 different languages to be interpreted as well. And it's a 1-800 number, so it's 1-800-272-3900. And I encourage anyone to call day or night if they're, just feeling stressed out, if they just got a recent diagnosis, if they just want an emotional shoulder to lean on and cry. Those folks are there for them. So,
yeah, Megan,
everyone to call.
what are some of the top reasons why people call the helpline?
Yeah, that's a great question. So most people are going to call to speak to someone for decision-making support or crisis assistance. Other folks call to learn about the symptoms of Alzheimer's and other dementias, to find out about local programs and services. We get quite a few calls about general information regarding legal and financial and care decision making. So those are kind of the top reasons that people are going to call.
Well, that you guys are working hand in hand in jail over there at Dr. Cog, the Area Agency on Aging. You probably get the same kind of questions.
Yeah, we do. But when it comes to Alzheimer's and, helping people really deal with, like, my mom won't sleep at night, and I can't deal with this anymore. We'll make that referral to the Alzheimer's Association. So back and forth. We can handle things like food and transportation and, lots of calls like that. But if it comes down to specifics about Alzheimer's disease and the specifics and how to deal with some of those behaviors, then we make a referral to the Alzheimer's Association.
Well, we're talking to Meg Donahue from the Alzheimer's Association. And Megan, you mentioned when they call that 24-hour helpline, the kinds of programs and services you might suggest to families. What are those? Can you give us ideas what kinds of programs and services?
Sure. So our programs and support services are really designed to connect individuals with peers and professionals to help make the plans of life and adjustments necessary to live their best life for as long as possible. So I already mentioned our 24/7 helpline. We work around local resources, like the AAAs and the Dr. Cogs, who we rely on for some of those local assistance, like food and transportation. We have support programs, so support groups that have moved back in person, which is exciting, and we also have virtual support groups. Within those support groups, we have specialized ones. So, we have a men's only group. We have a women's only group. We have a Lewy body dementia group. We have a grief support group. So we do have some specialized groups within that. We also offer education programs, anywhere from understanding Alzheimer's and dementia to living with Alzheimer's for people in the early, middle, and late stages. We have a legal and financial class. We also offer early stage social engagement programs. So, memory cafes or trips to the museum for someone living with a diagnosis. So our early stage social engagement program is very robust, and we have online tips, online tools, and we have techniques around safety. If you have someone dealing with wandering or elopement in the home or in a facility, we can help kind of navigate that.
The challenges for caregivers, and again, as we've been talking, it's usually family members, is got to be incredibly difficult and a full-time 24/7 type job. Am I right about that?
Absolutely. Yep. And typically unpaid. So it is important that we reach out and connect with those caregivers to ensure that they feel supported, that they know that they're not alone, and that they have resources out there. We talk about care options, and often individuals with Alzheimer's or another kind of dementia, their hope is to stay in their home as long as possible, or otherwise referred to as aging in place. And caregivers sometimes have a unique challenge in balancing several different roles, such as a partner, a parent, an employee. So if the time comes when someone's needing more support, there are several options for getting help with caring for someone with dementia. And I think it's important that we are that resource for those folks to let them know what their options are, whether it be home health care, adult day programs, short-term respite care at facilities. There's meal delivery services, hospice and palliative care. We've been getting some questions about how to navigate through that, and how to navigate through transitioning to a facility. So those are just some examples of how we can kind of lighten that load for a caregiver and talk through that with them. We also offer care consultations free of charge, in person or virtual. I oversee the Denver care consultations, and so I sit with families and adult children, and I work on an individualized, customized plan to make their life as a caregiver a little easier. And we have relationships. I've been with some of those families for the last 3 years. So it's a really beautiful program, and the first step is calling us, and then we can go from there.
Well, and I would think, Jayla, you might have more insight to this than I do. The earlier you get started with the Alzheimer's Association, what they offer is probably the best, obviously, right? Instead of waiting till things get along and you think maybe it's going to get better and it doesn't.
Yeah, I think it's so helpful. I mean, this is tough. And a lot of times, people with Alzheimer's are relatively healthy in other ways, like their body's healthy. And so this can be a long journey. I mean, over a decade, even more than that sometimes. And so really getting the support that you need from the beginning, because that's devastating when you get that diagnosis or your loved one gets that diagnosis. Understanding what you need to think about, saying this is a normal sign. This is things you can expect. Then as you move into the middle phases, how to deal with those, all the challenges, because every phase has a different nuances, right? And you need support. Please, I always tell people when you're going through this, there is so much support through the Alzheimer's Association that you really should utilize, because it can help you. All those financial decisions, all those legal decisions that you're going to have to make, right?
Right.
And how to help people with Alzheimer's in those early and middle phases while they can't make all the decisions, letting them make as many as they can, right?
Sure.
And letting them have some choice and some empowerment, not taking everything away. All of those tools and techniques can be, you can learn from the Alzheimer's Association. I think is so important.
Oh, I agree with that. Good said there, Jayla. So, Megan, let's talk about the financial end of that. How do they get help money-wise? They might not have the resources to handle, as Jayla just said, 10 years or more of help.
Yeah, I'm not super well versed on that. I would actually rely on those AAAs, DRCOG, the IHSS, those types of places to rely a little bit more on how they can get that assistance financially. I do know that there are paid caregiver programs out there. There are also a lot of grant and respite funds available, and I have those resources, to direct and navigate folks through. So there are some options in terms of getting care. Depends, do they have Medicaid? Are they, Medicare? All those types of things kind of run into play as well in terms of what their insurance coverage is. Do they have long-term care insurance? A lot of people don't know that long-term care insurance can cover quite a bit of skilled care as well as non-medical care. So it's important to really sit down and see, in hand, what do we have available to work with, and go from there. But there are options and resources out there. We're just here to help navigate them to that next step.
Well, and where do you get your resources at the Alzheimer's Association? Are grants, federal money, donations? How's that work for you guys?
Yeah, well, all of the above. We work, like I said, closely with DRCOG. We have, there's Next 50 grant is really large. Donations, obviously, is how we move forward in that next step of finding a cure and one day ending Alzheimer's. So getting people involved in our, walk to end Alzheimer's, and getting people in our public policy and advocacy realm, and making sure that people understand what ways to get involved are, is only going to help exceed our mission. And so, yeah.
Where do we go? Where's the website? I suppose that's a place to start if you want to get involved and help. It's the website.
Yeah, so it's actually www.alz.org/CO. And we also have 6 regional offices, Denver Metro, Boulder, Northeastern Colorado, Central, Southern, Northern, and Western. So we do have a lot of coverage, and everyone, runs and operates on the same mission. And, and so if anyone's ever interested in getting involved with us, please reach out. We are always open and available to take any and all volunteers to help fight the end of Alzheimer's, whether it be through volunteering roles, becoming an advocate, donating, or participating in the walk, like I mentioned, which is September 17th in Denver. We're always looking for fantastic community educators, or if someone has a passion in public health, they can become an advocate for public policies. So those are just some examples of ways to get involved.
Good, Megan. Before I let you go here, give us that 24-hour helpline again, because as you said, that's where it starts for many, many people.
Absolutely. That number is 1-800-272-3900.
Well, Megan Donahue, Alzheimer's Association, you sound passionate about what you do. You're good at what you do, and we're thankful that you are here and thankful that you came on No Copay Radio today.
Well, thank you so much for having me. I appreciate it.
You do, too. Keep up the good work. And Jayla, wow, we learned a lot today on No Copay Radio.
I know.
Wow.
So good. Such a good organization. So helpful.
Yeah, those numbers that Megan threw out there, they're just blowing my mind. The numbers of people and caregivers and money's involved. It's
and the
tough.
cost, people don't think about that.
No.
It's really so important.
Yeah,
we need to end this disease. We really do.
Absolutely, and they're trying their best, that's for sure. Well, thanks for being around this weekend, Jayla. We'll talk to you next week. It's No Copay Radio, brought to you by Dr. Cog, the Denver Regional Council of Governments, Area Agency on Aging, 303-480-6700. Have a good week.